Gina's asking me.
Hello, everyone, and welcome to HIV 2020, Where Are We Now? Today, we will be talking about the underrepresented experiences and obstacles trans men face when dealing with HIV/AIDS. We have a wonderful set of panelists who bring perspectives from research and psychology of gender identity in HIV, as well as experience in the field practicing HIV/AIDS medicine. They will reveal the main barriers trans men face and discuss the challenges that need to be made in order to better support trans individuals in healthcare, especially in HIV treatment and research. I am Carlina Marini-Lenzi, a marketing and events intern at QBI, and today we have with us Stefan Roniak, an associate professor at the University of San Francisco and nurse practitioner at the San Francisco Department of Public Health. We also have Solon Seneschal, growth therapist for diverse neuro, LGBTQIA+, gender, sexuality communities, mental health, anatomy, and psychology and structure, and identity and gender models researcher. Sean is also at the dissertation stage of the Human Sexuality PhD program at California Institute of Integral Studies. Before I turn it over to you both, I want to welcome our viewers to ask questions at any time using the comment section on Facebook or YouTube. I'd be happy to relay your questions to the panel and get you involved in the conversation. To get us started, could you each briefly tell us who you are and more about what you do? We're really interested in learning about your experiences, and so can you tell us about how you got involved in this topic? Sean, would you like to start?
Yeah, well, thank you for introducing me, and thank you for having me here. I basically I take the perspective in coming to this conference from a instructor point of view and a mental health professional and a researcher. I'm very interested in looking at models of gender as well as that relates directly to this particular event, looking at chemicals and how they affect gender, sexuality, and the body. And one of those chemicals would obviously be medicines such as PrEP, but other things such as foods, chemicals, spices, hormones, natural environments, and endocrine disruptors. So I'm looking at it from multiple viewpoints, but definitely as a mental health professional. So that's what I do and what I'd like to contribute here.
Thanks, Sean. Stefan, can you tell us a little bit about your background and how you got involved in HIV research and transgender issues?
Certainly. I was in nursing school when HIV first hit, and so I've been in HIV care from the very beginning. I did a preceptorship on the newly opened AIDS wards, 5B, at San Francisco General Hospital, and I worked at a local hospital doing AIDS care. And then I became a nurse practitioner. And in that capacity, I worked at San Francisco City Clinic. I was involved in many studies, including the CDC PrEP study in the 1990s. And then when I obtained my PhD at UCSF, it enabled me to do my own research. My transgender research grew from my work at City Clinic and what I learned from my transgender patients and some of the questions I saw that needed to be answered.
Well, thank you both for being here today. A large topic of this panel is barriers. Can both of you elaborate on some of the challenges faced by the trans community when it comes to accessing medical care, like for HIV?
I'll take that.
Yeah, let me go ahead. Certainly, in the mental health profession, I will have seen clients who may not even know about some of the care that they can get. They may not be aware of PrEP. There's a lot of advertising on the HIV aspect that you can see on TV that's becoming more and more diverse and involving more people, more communities, but not really for the trans community, the trans male community, men's community in particular. So there's this lack of knowledge of it. Many of them are surprised. So I also see in the nursing students that I get the first term, many of them are actually surprised that there's preventative care. They know about the HIV treatments maybe, but not the preventative care. So that's always interesting to see and to educate my students on. But also in the mental health, the clients that I see coming in, there may be a reluctance to take medicines. Maybe they don't they don't feel supported in the medical community, that their doctors may not really, or nurses may not really understand how they might be sexual, and that might actually influence what they need to be told about taking preventative care, such as PrEP, even use of condoms along with that. So there's a reluctance to that, and some of that I'll speak to a little bit later more on. They don't particularly feel welcome yet in the community. So being able to even talk about sex or their body um, might be an issue, and that certainly holds them back. Also, there's the financial aspect of it, where they go and get the money to pay for this, and that comes up quite often. But it's remarkably very few really know about the PrEP treatments, but also very few take it. So that's my beginning on the challenges. If there's anything Stephanie would like to say on that.
Yes, I would just add that there are several challenges that transgender people face, and these challenges can be regarding providers, and then there are larger systemic challenges. First, regarding providers. We have a real lack of trans-competent providers. It should not be incumbent upon each transgender person to have to educate their doctor, but that's often what happens with many trans people. Also, with regard to HIV care, one major barrier is that many providers do not obtain an adequate sexual history, and many hold on to the old stereotypes that transgender people all want a heterosexual lifestyle, which is not the reality. It's also important to look at the structural challenges that we have. Just as systemic racism impacts all aspects of society, including the healthcare system, so does systemic transphobia and homophobia. This has unfortunately been made worse by the current administration. In June, the Trump administration repealed all healthcare regulations that prohibit discrimination based on sexual orientation and gender identity. And there's been a constant attack at transgender people, including the ban on transgender people in the military and other attacks that occur on a regular basis. And also, given the threats to the Affordable Care Act, certainly the person sitting in the White House is one of the biggest challenges we currently have to the health of the entire nation.
Yeah, I want to add on the institutional aspect of it. Some of the things that I've heard and seen myself just going to different institutions, medical facilities, even in the Bay Area, there may be bathrooms that just have male-female. There may be some that might have male-female removed, but the images, the skirt and the pants are there. So there's no real acknowledgement of trans people, trans men, also the non-binary side of that, because there's quite a diversity and blending of different types of genders. So a person who's non-binary might not even have a bathroom to go to, or might have to sneak into one feeling very uncomfortable. So that is certainly a barrier that they face. So that beginning of being uncomfortable walking into a facility can also affect how they relate to their physicians or their nurses, or what other people they're going to see. They may, still, even in the Bay Area, run into the pronoun issue of what pronoun to use, or find that their physicians may not state their pronouns, which is one thing that can be done to really help, instead of only asking the client what pronouns they use or how they want to be referred to. If the physician or the nurse will state their own pronouns, that opens up an enormous feeling of being welcome. We don't see too much of that, but we're beginning to see that, but that's certainly not enough. So I think one big aspect of the education that needs to happen, that is a barrier right now to clients, is that the physicians and nurses and pharmacists as well don't really understand the diversity and expansiveness of the different genders, even the variations within a particular gender label. So, and that can cause a lot of problems, especially for the type of care someone might get. They may not need to get what used to be a standard care and standard levels of hormones for considering testosterone and estrogen, for example. So that knowledge has to be expanded beyond just standard protocols. So I've run into that with clients as well. So I think that continuing education should definitely include not only the standard, but also the variations of being able to make modifications in treatment based on how that person feels. So that's another one. In terms of the variations, it is a challenge for the people seeing the medical field and mental health profession, but there are also concerns we understand on the other side of liability. How far will they vary the treatment protocols, and do the physicians have resources that they can go to get suggestions? So that's important, but also informed consent for the clients. That if a patient is going to be given treatment or even a variation in treatment to fit their needs, which is often needed, that informed consent needs to be there. The client needs to understand what they're getting and the risks associated with it, whether it be PrEP or other kinds of care that might go along with that. So that those are issues. The last point for right now that I can mention on that is there may be doctors and nurses and even pharmacists that are willing to treat, willing to give it a go with a little bit of education in the area, but that can do harm if they don't have enough, because they may be personally uncomfortable or not even realize how uncomfortable they might be. I've had people tell me that they walked into offices and that they thought were going to be supportive, and a physician dropped their chart because they were so stunned by what they saw and what they had expected to see in the person. And the person laughed, the client laughed, but they were really greatly affected by it. So we'll see situations like that. So there are barriers, and some of that can be dealt with education. Definitely. Another example, a client was trying to get a variety of treatments kind of in between. It wasn't particularly the standard, and they were going to also need to talk about sex and to take PrEP and perhaps other conversations to help them. But they were basically told that, well, there isn't research on you. There's research on males, there's research on females, but there isn't research on trans males. So we really can't help you. And the person left the office just saying, well, I'm not a Martian. I've got bones. I've got muscles. I've got a body. I've got a brain. I'm not a Martian. So that was a very, very interesting interaction that was upsetting, but it made the point. Trans people are not Martians. So that's a point I leave this piece.
Well, thank you both so much for your comments on that. This is clearly a huge problem that needs to be addressed. So your insights on the barriers that they face in healthcare are essential. So I want to shift now to discussing preventative HIV drug PrEP. You've mentioned a little bit, but Stefan, can you briefly explain what PrEP is for anyone who might not know?
Okay. Yeah. The idea of PrEP, or pre-exposure prophylaxis, grew from PEP, or post-exposure prophylaxis. And it was something that developed in the mid-90s. The idea that whereby an individual who had a possible high-risk exposure to HIV started taking HIV meds within 72 hours of the exposure. And they would take those meds for 28 days. That was PEP. And we did this for many years. We would be prescribing that medication for those people who came into our clinic and were concerned about possible exposure. Well, we don't have any data to show whether PEP actually is effective. We believe it may be 80% effective in preventing infections. So the idea was that if PEP can be effective post-exposure, what if somebody was put on medication pre-exposure? And so that's where PrEP came in. And it was approved by the FDA in, I believe, 2012. So it may be even more effective to take pre-exposure for the entire period that an individual is at risk for HIV. Current PrEP drugs are that have been approved are Truvada and Descovy, both made by Gilead. The idea is to take the medication as prescribed once a day, and that studies have shown that it can be 95% effective in preventing HIV infection. So very important HIV prevention tool.
Stefan, you did a study on PrEP knowledge within the trans male population, and your findings show that there is a lack of accurate information about PrEP and its possible side effects for the trans community. What were some other main findings of this study?
Well, that was an important finding, that there needs to be certainly more education to the trans community, letting the trans men especially know that PrEP is appropriate for them if they're in a high-risk situation. Other findings from that study were that it was important to understand the economic reality that many trans men live and how that can impact their access to PrEP. Many transgender individuals, and trans men included, are economically disadvantaged because of the inequities in society, lack of being able to find a job. And as a result, many are unstably housed, which can certainly impact whether or not somebody's going to be able to take a medication home and whether it's going to be safe at home. So, and affordability was a factor, because many stated that they were not even able to pay the co-pays for the medication, that was prohibitive. Many reported that it was also difficult for them to request time off for a medical appointment, which would be necessary to get PrEP, for fear that it would be another excuse for an employer to fire a trans worker. Trans workers are in a far more precarious situation than cisgendered workers, and suffer the discrimination and fear of being fired. Also, besides the difficulty of finding a trans competent provider, and one who didn't assume that they were living a heterosexual life, many had to inform their doctors that one of their major concerns was the fear of getting pregnant and the need for contraception. And this was found almost universally among the trans men, that their providers didn't ask any questions about pregnancy, risk of pregnancy, or offer them options to prevent pregnancy. And I think that's a very important finding for any providers, and certainly for pharmacists as well, who work with the transgender community. Okay.
Well, thank you so much for that explanation, Stefan. Is there anything, Sean, that you would like to add to this discussion of trans men and PrEP?
Well, I think you covered quite a bit of it. I think you're mentioning the pharmacists is really important, because they are becoming more involved. There are more articles where they were talking about being more involved to be part of the team that needs to work with trans people in terms of their medicines. If they're not informed about PrEP, the pharmacist might play a role if they know they're taking hormones and they come for the hormones, or for treatment for STIs. The pharmacist might be able to be of help there, even though it's not a very private environment to talk to your pharmacist, usually for anybody, that they might be able to provide that information and that support as well to make it more available. So I think the other aspect is to add that if the teams were more integrated, where not just one doctor is expected to be speaking about PrEP or other treatments for anybody, including trans men, that the cardiologist might be able to get involved. They're talking about prevention, the PCP, the pharmacist, the nurse, the people in different aspects can be able to bring up some of these things just to make sure. For example, bone health, there are some issues potentially with some of the treatments to prevent, or after someone gets HIV, that it might affect the bones. Well, so then your bone doctor, your rheumatologist might also be able to know this. So I think if the education is not limited to the PCPs or the endocrinologists, many of whom may not be interested, actually. So I'm hearing from professionals even. If more doctors are involved, then in having these the education, I think that would be really beneficial.
Well, thank you both for illuminating these problems that many probably weren't even aware of. So now shifting to some more current events, the trans community is disproportionately affected by homelessness, poverty, and unemployment. So they're specifically vulnerable to the impact of the coronavirus pandemic. How has the COVID how has COVID affected trans men and their access to PrEP?
Well, let me mention certainly in my practice, um, the biggest thing we see is depression. People, from wherever they're coming from, COVID is causing depression, and people are being treated more for that. So um, they're needing to contact their physicians who might be able to prescribe, and so that opens the door to potentially being treated for being made more aware of that. So that's both a negative and a positive aspect of it. But many are not as active as they used to be, but might still be engaging in unprotected sexual behavior. So depression definitely is one of them, stress. But one thing I leave many of my clients with is the thought of, well, you now have a year to prepare to come out again. And in that time, you can work on your health, you can work on your mental health, your physical health. There's a lot of information that you can get on the web. So this is an opportune time to really prepare what you can do, but obviously they need a lot of support. Now with telehealth, even for medical, it might be a little bit easier to talk to a doctor about sex, sexual behavior, treatments, because you can do it on the video. You don't have to go in person and deal with the institution and other things that you might run into. But still, the depression is major, and that will certainly affect people's willingness to even take care of themselves. That's what I'm seeing.
Thank you for explaining that for us. I want to end by looking toward the future and what can be changed. So what improvements need to be made within the medical community in order for trans patients to be provided with appropriate information to fit their medical needs?
Well, we certainly need more educational outreach, certainly to medical providers. More education in nursing schools and in medical schools and schools of pharmacies. And I think that state boards should mandate a certain number of continuing education units for transgender issues to really provide an incentive for people to be taking those classes and learning more about with regard to education. That's one factor. But there's also something to be said about experiential factors as well. And I'll let Sean take that.
Yeah, so I think overall, I agree with Stefan regarding the institutional aspects that need to be addressed, the education, making sure to have not just the standard, but also extending into variations that you're going to see in the community. It's not necessarily just a binary trans community. It extends way beyond, and the bodies may not, the bodies might be very different. People may have a variety of hormones as well as body parts that need to be learned. So the education is huge. Integrating more physicians into needing to have this kind of education is important. And but I think a key thing is to make sure that the institution has appropriate signs, information, a welcoming environment. But practitioners can certainly help their one-on-one practice, talking to people, is to speak to the person, not the trans. So, and you can even think of it as just a client-centered approach. We do that in mental health. Physicians often will try to do that, but you're showing care for the person, regardless of their body, regardless of their environment, regardless of their economics. You're dealing with the person who's experiencing, and you're not dealing with a label. So the label is kind of secondary, but deal with the person. The label is just to help you steer some of the treatments. So just, I think a focus on treating the person who, rather than the trans person, is a way to go. Just to start with the person and find out what their configuration is. That certainly is one thing. The other thing I found really effective, and I've had a few clients do what they call feedback. After you see a physician, oftentimes some institutions will have feedback forms that you fill out, and how important they actually are. There have been cases where the person gave feedback about something in particular, and in a few months they actually saw a change because the feedback forms actually do get read by usually outside institutions, and then that gets fed back. So, making suggestions is really important. So I think there's plenty of room for growth, and people seem eager to do so. But I think if it can be presented as a benefit to the professional themselves, how will it help them be a better doctor or a better nurse? I think is useful as well, because then they have something invested in it themselves, even though their goal is to help other people. We want to work this on both fronts.
Sean, I think you were touching on this idea of a trans-friendly clinic. Can you give more details about what a welcoming trans-friendly clinic would look like?
Yeah, it would be one where walking into the facility, you can see some kind of representations of all kinds of people, genders, economics, just a variety of things. So now we're seeing more gay and bisexual, just a whole slew of representations, but some more to include trans people as well, and especially the non-binary, who right now are the most left out. Well, maybe not the most. There's also the agender, which may or may not be part of the non-binary community. So a community where the visuals are there, there are brochures, people are addressed and they're asked, how would you like us to refer to you? And then to make sure that when the person is in the office with the practitioner, that they're talked to as a person who has whatever situation they have, rather than, oh, you're the trans client. So that would be one thing to do. I think having information is really important about the varieties that person might have in their body, not to assume that a trans man, for example, has a vaginal entry or what they call front hole, or not. They may or may not. And somebody may or may not be taking hormones. You can't assume. So asking the person is a really great place to start. But showing care is the most important. Showing that you care, and a person can pick that up. That it's not always clear how to make that happen, but we've all been to offices where you walk in and you feel welcome. You can feel it. And even if the doctor doesn't know everything, you can feel that warmth. And other places, they may know things, but there's a coldness and a distance that is not inviting. And the damage of not inviting is you may not get the information that you need. The person may feel, I'm not going to tell the person this. So the more inviting, the better the healthcare can be, and everybody wants that. So, and be open to feedback on everything from bathrooms to comments. Some doctors might make comments that seem really startling, and I'll leave you with one last interesting example. On the other hand, they may be well-meaning, but being able to have that warm relationship, it can be worked out, and the doctor might get information to help them grow, but it also helps the patient. There was one patient who had high blood pressure, and the well-meaning cardiac physician, I was told, said, well, maybe you should just go off testosterone so that your blood pressure drops. And the client kind of laughed and asked the doctor, well, let me see, would you like to be castrated to drop your blood pressure? And so they both kind of had a good understanding, but the dynamic was workable. It wasn't like, oh, I'm never going to come back. It was a laughable moment, really. So that warm, welcoming environment allows for everybody to make mistakes and to tweak their way through this together. And that's what we want. We want the practitioners and the clients and patients to be growing together.
Thanks, Sean. Is there anything that either of you would like to leave our audience with? Like, where can they volunteer if they want to be more involved in the community?
Yeah, I would say to search for diversity centers in your community. There's certainly a diversity center at Santa Cruz. They usually have programs that deal with PrEP and other ways to stay healthy mentally as well as otherwise, and to connect, especially in this era of COVID. There are a lot of online groups. And then there's the Billy DeFrank Center in San Jose. Then there's the LGBT San Francisco Center, of course. And, different centers have different types of programs, but being able to volunteer is always welcome at this point. And the benefit is that you get to learn more and to make your own suggestions to what you think might be helpful, because we all need great ideas and they can come from anywhere.
And I would add St. James Infirmary in San Francisco, the Pacific Center in Berkeley as well.
Oh, yeah, right.
Okay, thank you. So as we come to the end of our time together, I'd like to thank both of you so much for agreeing to join me today and share your unique perspectives on all that you do to support HIV research and the trans community. And thank you as well to our viewers for joining us. We welcome you to subscribe to QBI TV while you're here. To stay tuned for our next episode. So see you next time.
Thank you.